Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Real glad that you could return for another segment. In this segment, we're going to be having a conversation with Dr. Rajeev Jain. He's joining us as a board-certified gastroenterologist at Texas Digestive Disease Consultants to discuss the importance of early treatment for GI symptoms to avoid future complications. Now, in light of the Trust Your Gut campaign, Dr. Jain wants to educate the public and encourage fellow doctors on normalizing the conversation with patients regarding those uncomfortable GI symptoms. Welcome to Health Professional Radio, Dr. Rajeev Jain. Thank you for joining us this evening.
Neil, thank you for having us. I think it's great that we can get our message out to our colleagues about trusting your gut.
You're a board-certified gastroenterologist. What led you to Texas Digestive Disease Consultants?
Well, I completed my training in gastroenterology, both residency and fellowship at UT Southwestern. And as a fellow, I rotated with my senior partner at the time and just was like, it would be an amazing place to practice. It's private practice, but still quasi-academic in that we have a residency program. So I got to do a little teaching, a little training, and still take care of patients. It was the best of all worlds.
Why do we need to monitor our GI symptoms rather than just treat them or make them go away if possible?
Well, Neil, I think the key point for my colleagues out there listening to this is that we may think a lot of different things, but if the patient doesn't tell us and we don't inquire, we'll never know. So I think what we're seeing from this Trust Your Gut survey is that the majority of our patients do not feel comfortable talking about digestive issues such that they won't bring it up. And despite 40% of them having symptoms, none of them will, the minority of them will discuss it. So unless we kind of delve in and specifically ask, are they having bowel dysfunction, we may miss a large proportion of our patients suffering from digestive symptoms in silence.
Is it normally a case of embarrassment, simply not wanting to talk about symptoms, or maybe a bit of education? Maybe a patient thinks that something is the norm because they eat certain types of food or don't eat on a regular schedule. Maybe they've come up with some reason of their own that they've normalized what they're feeling.
Neil, you make great points. I think it's all of the above. Almost every culture has it stigmatized to speak about your bowel function. And so it's not something that's typical dinner conversation or at the coffee table or water cooler. So I think one is that we have to overcome the stigma. We have to normalize the conversation. Two, I think what you mentioned about embarrassment and perhaps fear of being judged, patients don't want to talk about it for those reasons. And then if we don't talk about it, we don't know what normal is and what abnormal is. So I think those are the key parts of trying to get this awareness campaign out so that we can make sure our patients know better.
Well, talk about the importance of seeing a doctor about your GI symptoms, some of the problems that can arise if you decide to ignore it or are just too embarrassed or just don't want to bring up the conversation with your doctor.
I think my colleagues are well aware that most of our digestive disorders that we see and diagnose are very well manageable, and from the malignancy side, caught early are curable, caught later are not, and the outcomes are poor. And so this not being willing to discuss potential symptoms that could be a manifestation of a substantial disorder just delays care, and delayed care leads to poorer outcomes. So we want a healthier population. We need to intervene sooner.
So how can you remove the stigma? How can you get the conversation started?
I think the best thing from the provider standpoint, we physicians need to not feel stigmatized ourselves and need to be very open and honest and transparent and talk to our patients in a way that they feel comfortable, that they trust us, that we have this safe environment. And I think that allows patients to freely let you know what's happening with them. And then you can move forward from the information they start giving you.
And that's very interesting because as a patient, I've often felt that there was no subject that was uncomfortable for my physician because, well, they're a physician. So anything, they've seen it all, they've heard it all. But that's not necessarily the case. You can feel just as uncomfortable as a provider as your patient feels in discussing this.
Neil, I think for sure. I mean, all those providers out there, they're humans. And, in a certain specialty, you're used to talking about certain things. but maybe a non-gynecologist is not comfortable talking about gynecological issues. And so I think a lot of providers may or may not be comfortable talking about it. And I think if we give that space to the patient, and sometimes it may be appropriate to say something silly like stool is cool. And, it makes the patient chuckle a little bit, and it, takes the pressure out of the situation. They're willing to talk. Sometimes comedy is not the way to go, but you have to kind of, feel it out. And
kind of read the room. Yeah.
Absolutely.
What is the Trust Your Gut Awareness campaign?
So the Trust Your Gut campaign is from the American Gastroenterological Association, and it's really aimed at patients. And we're trying to have this awareness campaign so that we can shorten the time from a patient's onset of bowel symptoms to discussions with their healthcare provider. So we're just trying to shorten that time period between symptom onset and diagnosis, hoping to move the needle forward in care.
There are a lot of folks who have a caregiver. They're of sound mind, but there's someone there that's kind of a go-between, a liaison between them and their care team. If a caregiver feels that there's information that the doctor should know, and then when the patient is in the presence of the doctor, could that be a problem? Do you encourage your colleagues to rely on caregivers for information, even though the patient may not feel comfortable?
That's a great question, Neil. I think it comes down to, again, you mentioned if the patient is of sound mind and they have brought someone else with them, at least from my perspective, I ask the patient, do you want me to get any additional information from this person you've brought with you, if that would help? Or is this person here mostly to be a second set of eyes and ears so that when you go home, you're able to say, yeah, that's what I heard and that's what the doc wanted me to do. And so I very transparently will ask that question up front, because sometimes they will clearly say no. They're just here to listen and not to tell you any signs or symptoms. And they may have a good, honest motive, or they may have an ulterior motive. And so I like to make sure the patient is the decision maker.
When it comes to those who are willing to talk about their GI symptoms, do you find that older patients are more or less willing as opposed to younger? Maybe men and women differ in their willingness to talk about certain GI symptoms?
Neil, I think it really comes down to the individual. It's really amazing. I mean, there are young people that will not, talk about this at all. And there are some older patients that they're like, I've been through so much, I have no modesty. And they just go on. And it really comes down to the individual. And so, again, when a patient comes to see me in the room, many times it's like, is there anything else you're worried about or anything else going on? And I find that not saying simply, are you, your bowel habits okay? I specifically will ask them, tell me the number, frequency, consistency, because that opens the door for them to say, well, I'm only having one bowel movement a week, or I'm having 8 bowel movements a day. Unless you clearly ask a question, sometimes they'll think it's a new normal for them and they won't bring it up.
Is there anything that you'd like to add for our listeners? And then give us a website where we can learn more about the Trust Your Gut Awareness campaign.
You betcha, Neil. I think I would ask my colleagues to help their patients, one, know what's normal. So you can't assess for a change in bowel function or bowel habit or digestive symptoms if you don't know what your normal is. So I think it's important to ask patients to think about things like that. And then to what we talked about earlier, the second point I would make is really get your patients to feel that it's okay to start the conversation about their digestive symptoms. It's a common problem. 40% of Americans suffer from significant digestive issues. They shouldn't be afraid to speak up to the provider if we don't bring it up. We may think they have other issues that are more important. And then finally, I think limiting the delay of care. As I've mentioned, GI conditions are treatable. Our patients don't need to suffer in silence. I think those 3 points, if we as providers can get that across to patients, we can move the needle forward. With regards to the website, if patients and providers want more information, they can go to the American Gastroenterological Association, or AGA, and specifically the URL for patients, they can look up patient.gastro.org/trustyourgut. They'll find a wealth of vetted information that will be helpful.
Rajeev, I appreciate your time this evening and this information. Thank you so much for joining us here on Health Professional Radio.
Neil, thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Rajeev Jain. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.